Hi guys, I decided to do this video because I just had a mastoidectomy and a tympanoplasty. Um, I've had severe ear infections for 3 years and antibiotics couldn't resolve it, so we decided to drain my skull because it spread to my mastoid and my ear of infection and, have the procedure. So one of the reasons I'm doing this video is because I couldn't find hardly any reviews or anybody that, other than one woman, that had been through it. And it's kind of scary because they're gonna paralyze your face and gut your ear and drill apart your skull. And so I was pretty terrified, but it it's nothing compared to what I was facing with the infection and what I'd been dealing with for the last 3 years, because the infection is very severe and it's unusual, some sort of unusual bacteria and fungal elements. But anyway, just thought I'd tell you guys a few things. So this is the thing you come home with, and I'm just putting it on right now as a example because I'm 5 days in. And so this would have gauze in it, and it'd be over your ear, covering your ear and your mastoid bone, this whole part of your skull. Like, it goes most of the way back to the middle of my skull. And so that is packed with gauze, and it's pushed up against there. But there is some weird things to expect, so I'm going to go ahead and take this off now because I don't need it right this second. But you can sleep in it and use it for, protecting your eardrum and the incision. So one of the first things we noticed was I was told my ear was going to be really full, but due to the severity of the damage and the infection that was in there, it doesn't feel full to me. Probably because I've, had an infection so long, it was already full. So that part, awesome. But so this whole part of your skull right here is packed with like this spongy stuff after they drill out the infection. And we get back and we decided to stay in a hotel to stay close to the hospital because I live on a farm really far away. And my ear's just bleeding. It's coming right through this thing and right down my face. And it continued to persist throughout the night and the next day. And my daughter here, who's taking care of me, would not check it, would not take the packing off or anything like that because she wanted to do exactly what the doctor said to do. And so the next day she takes it off, and my whole ear, my hair is covering it up. It's actually not as bad of an incision as I had expected. So they did shave my head, but not as much as I thought. And he was kind enough to leave me that little piece there to try to hide it with. But this whole part right here was whelped up and squishy. It was freaky. You could literally hear noise coming from it if you touched it. Like, my daughter explained it as a creaking chair, and it freaked her out pretty bad. And unfortunately, when I kind of pushed on it barely at all, blood just shot right out my ear. So that was pretty freaky, and that continued to persist up until yesterday, and I'm at day 6 now. And it's still pretty full, but it seems like the squishy moisture part of it has moved more towards my inner ear. And so that was one of the scariest things. And of course there's pain. There's feels like someone took a fillet knife to my inner ear and my canal and the whole 9 yards. But from what I understand, he took a lot of stuff out of there, so I'm not surprised. My whole left side of my skull is pretty tight and decent amount of pressure, but like I said, nothing like the pressure of what the infection created. And then there's some muscle pain here. I'm assuming that, a muscle was cut through and disturbed, so I wasn't expecting that, but once again, still thankful that, everything went as well as it did. And then I was sent home on hydrocodone, so I have pain medication, but I'm not a big fan of it, so I've tried to take no more than 2 a day, and that was mainly the first few days. And so I did deal with a decent amount of what the pain's really like, and it is a bit severe, but nothing that I or no one else could handle. So thumbs up. I think if you gotta have the procedure, you'll probably be okay. Another thing to think about is they, give incisions in these facial nerves, and I was um, told that there was a chance that you could have facial paralysis, and so I'm really thankful that that didn't happen. Oddly enough, when I got out of surgery, I wasn't even thinking about that. I was just glad it was over with. And when I looked in the mirror, I was like, oh yeah, I'm not paralyzed. Awesome. So, yeah, just a few things that's really weird, but tolerable. And, if you have a problem like me, it is, in my opinion, at this point, well worth the procedure. Is my hearing restored? No. But I'm only 6 days in. It may get way better. Um, but I'm not hearing a lot of the weird things I was hearing before. So, a lot of promise for that, but I just wanted to, you know, put something out there for people that are going through this and are scared and don't know how it could be afterwards or during or whatever. But there you go, folks. I'll probably upload another video later, maybe with some more details, but that's it for now. Thank you.